I'm going to be presenting at BSH on this occasion the findings from the dose expansion cohort for patients with follicular lymphoma. These were 90 patients in total that were investigated with a median age of about 60, but importantly the maximum age of this group was 90. These were heavily pre-treated patients, so they all by definition were double refractory to alkylated therapy and monoclonal antibody. There was a large proportion, about 50% of them had POD24, and so these were a heavily pre-treated group with a median prior lines of therapy of 3. It is a very efficacious drug, so the overall response rate in this cohort of 90 patients was 80%, with a CR rate of 60%, and this is for fixed duration therapy for 8 cycles if a CR is achieved, or going up to 17 cycles if the patient achieves a partial response or stable disease. The follow-up is still fairly short-term, but it's an 18-month follow-up, and for those patients that are responding, it does seem that we're getting durable responses as well, with a progression-free survival roughly around the 18-month mark as well. In terms of toxicities, there was a low rate of CRS and ICANS, and the majority of patients who were getting CRS were at the grades 1 and 2, and there were no grade 3 ICANS reported. So showing that these are efficacious drugs, very exciting drugs for these patients that can be manageable in terms of toxicity profile.